Hi, Dan Williams, Survive Outdoors. If you're new to the channel, we do wilderness medicine videos showing you how to take care of injuries in the outdoors. We talk about zoonotic illnesses, snake bites, tick bites, spider bites. We do some gear reviews. If you're not new to the channel and you like that kind of stuff, hey, subscribe. We'd love it. Give me a thumbs up if you like the video. Today is a very important video. We're talking about an 11-year-old girl that came in and that I saw in the urgent care clinic. This is, when you get a kid that comes in, you know, all hands are on deck. We're trying to figure this out. So mom brings this 11-year-old girl in, very cute, very articulate, intelligent girl. She's had a fever for 3 or 4 days, about 100 degrees. All the rest of the vitals were totally normal. She is pleasant. She's not in any distress. And this is right now in Northern Illinois, COVID is peaking again. So immediately we're thinking COVID, strep, influenza, what's really going on? The main complaint was fatigue, sore throat, low-grade fever, and the mother told me she was having some knee pain. So COVID was negative, influenza was negative, chest x-ray was negative. She had no respiratory symptoms, but we're reaching here trying to find out what's going on. Her throat was totally normal, did not even insinuate anything like, you got to think of mono, strep, viral pharyngitis. And then in pursuing the history, we find out that she was seen by 2 other healthcare providers in the last 6 months. One was a visit for a strep. I don't know if they did a strep test, but she was treated with the mox, and 4 weeks later she is back into the clinic. So now I sit down, and now we have to, push and the limits of the history. What's been going on 3 months, 4 months, 5 months? Mother then tells me that for the last 6 to 7 months, about once a month for 5 or 6 days, she was having a fever. For, 99 to 100 degrees, never over 101, and it would go away. And this would prompt her to see a doctor or a PA or NP. So, really unusual for Lyme disease for that to happen. You do get joint pain with Lyme, but this was really kind of a shot in the dark here. I asked, do you live in the city? Do you live in the country? Well, they live in the country. They do have pets. Pets can bring in the tick. So I go, hey, it's worth a try. We really should draw the labs and see what the heck. So, little girl wants, or little boy, or even adults, many adults for that matter, don't want to be stuck with the needle, but we did the test. And I drew CBC, looking for any infection. We did a babesia, ehrlichiosis, and Lyme. And I'm going to put a link at the bottom to my other videos on ehrlichiosis and babesiosis. Those diseases, they accompany Lyme at time to time. So we drew the labs, and it came back with 5 positive bands for Lyme disease. Now, I discussed this in the past where you need at least 5 bands to get a positive Lyme. Some of the bands are more specific towards Lyme than others. So clinical suspicion is really important. If you have like 3 bands and it basically meets your criteria on your exam and the history for Lyme, I go ahead and treat. But she met all 5 bands. She definitely had Lyme disease, and she had joint involvement. So she gets treated for 4 weeks. 28 days of doxycycline, and there is some concerns. Oh my gosh, doxycycline it binds with calcium, it'll turn your teeth yellow. It's less than 10% of the cases, and it usually has to be more than a month, but benefit versus risk, you definitely have to treat in that scenario. So I got lucky on this, and to my providers out there, index of suspicion, that is what's crucial. Does Lyme cause a fever once a month for 5 to 6 months? Very unusual, very rare. No rash, so she lives in the country, has the pets that raise the red flag, might as well draw the labs. So there you have it. Very important case, 11-year-old with Lyme disease with joint pain. All right, guys, I hope you found this video beneficial. Think about it when you're out in the woods. Permethrin on your clothes, very important. Look for those ticks. Take care, keep your eyes on the rise and your face to the wind. See you next time.